Thank you.
We actually forgot to mention, but I think it's kind of obvious to everybody now, this is actually being streamed. You're all being streamed. And so this does also mean that when we get to a plenary discussion, you will need to come to the mic in the middle there to ask your questions. So yes, where were we? Yes, and that the jobs seem to be used interchangeably for similar roles. And this is important. This is the difference between jobs and roles. So this comes back to the functions and who performs them. So sanitary inspector, hygiene inspector, environmental health officer, community mobilizer, community health worker, all of these seem to be performing very similar roles, but there is very little standardization. And so we'll get to that later when we talk about recommendations as well. So then looking at the key sector actors and what they are, what their roles are in terms of human resources. Local government is mandated, but not resourced or under-resourced. Obviously, this is linked very much to decentralization without necessarily the appropriate allocation of decision-making and human and financial resourcing. It links back to the issue of not having a clear institutional home, facing problems of prioritization, nothing new. What it means in practice is that local government staff, particularly when you get to the community level again, are overloaded with tasks they are expected to perform. And often little consideration is given of existing workload before adding new activities to that. When new programs start that want to work with the local systems and therefore want to work with the existing health extension workers who are already quite busy people, and more gets loaded onto them and onto them and onto them. And one issue that came back across a number of countries are issues around recruitment freezes and quota, and that's very much linked to the fact that they are mandated, but not necessarily giving the decision-making power to hire the local government to hire who they need when they need it. Obviously, unattractive remunerations and conditions don't necessarily attract the skilled workforce that you need. And there are a myriad of reported missing skills and missing positions. And so I won't go to that in detail, but importantly, this really crosses that or stretches that range of functions that we talked about earlier. And overall, women are underrepresented in public sector jobs. And that was found across all countries. I mentioned earlier already that rural sanitation and hygiene depend very heavily on volunteers, but also they rely strongly on the health sector, particularly again when you come back to the community mobilization work. And so here is the example of, and I mentioned this earlier already, so I'll skip the Philippines example. But the interesting thing here is that these barangay workers are actually volunteers, but they're performing roles that are official roles. And so aren't necessarily remunerated for that. And similarly, Rwanda also showed a clear shortage in the number of people available to cover the villages. Another very important finding is that there are strong variations in staffing across regions. This in itself is not such a big surprise, but what's behind it is. And so these are examples from Nigeria on the left and Ghana on the right. And so Nigeria, these are LGAs, so local government areas. So these are just a sample. These are just a small sample of LGAs across a number of different states in the country. And it just shows the staffing numbers. So you can see the big variability there, with some LGAs having hardly any WASH staff and some having reasonable numbers. And same for Ghana, it's by region. And there, the other interesting thing, particularly in Nigeria, is red represents males, blue represents females. So you can see the big discrepancy in female versus male staff. Now, in terms of reasons, there seems to be quite a clear overlap. And this is a research crowd, so I won't say that there is a proven correlation, but there is a clear overlap between where there is strong donor activity and program activity and the amount of local staff, government staff, not necessarily paid by that donor, but the fact that the donor programs are active there seems to have an impact on the staff available or staff present, because there's been a lot of capacity development, there's a lot of working with the local government, and that does lead to those governments then prioritizing sanitation and therefore making more staff positions available, etc. So there is a very clear correlation. There's also a very strong role that these development partners play in capacitating that local government staff. And in Ghana, this was very clear. In Ghana, the people we consulted with said there is a very clear understanding that it's actually the NGOs and the programs that do most of the capacity development of the local government staff. But that means that that staff being capacitated, this is only that staff in the regions where programs are strong. And there where there aren't necessarily any programs in place, there's also less local government staff, and plus they are missing out, if you like, on those capacity development opportunities offered by the partners. And so this is quite an important finding, and not necessarily one that's easy to address, but we'll come back to that in the recommendations. And here, this is the same point, but this is about where the NGOs are most active. And so this is how we could map where NGOs are very active, and then we know where big programs are taking place at the moment versus that previous slide with the staff. And there's clear correlations there, or there seems to be overlap. I mentioned the dependence on the volunteers. What's interesting here is that top row shows where there are official government programs in place. So it's an official government program or policy to use volunteers at the local level. And so Ghana doesn't officially have that, at least not for the WASH sector. They do have health volunteers, and those health volunteers do play a role, but they don't have necessarily a reliance on volunteers as part of their policy, like some of the other countries do. And this can translate to, a CLTS strategy for the country, relying very much on, natural leaders and community WASHCOMs, the WASH committees, etc. In some countries, those people might be remunerated in some way around travel allowances, stipends sometimes, but it's obviously very ad hoc. And obviously, the other thing we looked at was motivation, and what drives people to be volunteers. And a lot of that is about, giving back to the community, some status, and ability to make a living, at least from those small stipends. But what's interesting, and a slide we didn't show here, is that in Nigeria, we looked into this in a bit more detail, and there's also very much a volunteer fatigue. Again, not surprising. Because the WASHCOMs, those WASH committees that are being set up at the community level, are expected to continue to perform roles. Initially, their role might be around, the ODF triggering process and getting the community to ODF, but then actually they are expected to continue to perform a lot of roles around continued monitoring, continued oversight, without necessarily being remunerated for any of that. And lastly, on this point of the partners, is that the private sector engagement is still quite limited and largely informal. And so we're not spending too much time here on that, but in some of the country assessments, we are looking a bit deeper into the roles the private sector performs or doesn't perform, and what some of the gaps are overall. So last point on this is really that the development partners play very important roles, play key roles, but they do also disturb local systems and processes. They encourage and support local investment, and I just talked about that overlap in staffing, but their projectized approach also does hinder permanent staffing. And one point I didn't make, but there's also a correlation not just between where there's program activity and where there's local government staff. A lot of those local government staff are volunteers. And the other point here is an obvious issue around brain drain. I mentioned earlier there aren't necessarily clear career paths, particularly in the public sector for sanitation and hygiene. And so people that do want to develop onwards will obviously look for opportunities, and those are often offered in the programs, even if those are only temporary for a few years. And so people are moving on, and that's a very logical thing from the individual's point of view to pursue your career into an NGO or a UN agency, etc. But from a public sector and local staffing point of view, it obviously is a disruptive factor. I think one last point to make here as well, and this comes back when we talk about capacity development, is that obviously when you look at capacity development for the sector, it's not just the public sector staffing that needs to be capacitated. That skill building needs to happen across private sector, development partners, and public sector as well. So I'll spend a little bit of time on trends. And here really we're just highlighting a few. There are more. The report will go into much more detail on which trends seem to have the most impact on human resources. Obviously, climate change will impact jobs, and at minimum will impact the competencies people need to perform good sanitation and hygiene programming. It'll also require much more concerted working across departments and across sectors. And I haven't touched on that so much yet. We'll talk a bit more about it when we get to the next sections, but that lack of cross-sectoral coordination and work, also when it comes down to the staff actually performing roles at the local level, is a challenge we found. There has been a strong focus on getting to ODF, thanks to the SDGs. A lot of countries, and the work before the SDGs, a lot of countries have put in place strategies and plans, and so that has been a strong focus. And so in terms of staffing, there's been a fair amount of investment, and again, a lot of those are volunteers that, you know, invest in the community mobilization processes needed to get people to access to basic sanitation. Where we obviously need to go to now is making sure that the staff, the workforce, has the skills it needs to coordinate or undertake, perform roles linked to getting to safely managed sanitation. And so far, the jobs have focused very much on getting to containment, and not so much to the other parts of the chain. And in terms of a trend, there is the larger looming issue of, you know, the growing focus on urban, the reduction in rural sanitation funding that we've all been feeling for a while, and linked to that, obviously, the availability of funds for human resources. Digitalization is an important one because, again, that has a big impact on the skills required. It's a great development, and it'll help our sector, particularly around monitoring, but it also does require an extra level of skills and competencies that people will need going forward. So on the skills supply and capacity development, I'm almost there, and then I'll stop. Then we'll have a little discussion. This again is a glass finding, so preliminary finding. Again, looking at those countries that we were interested in, so mainly Sub-Saharan Africa and South and Southeast Asia, 86% of countries there report that there is an insufficient supply of graduates from training institutions into on-site sanitation and hygiene. And similarly for hygiene facilities and technology and behavior change. And that gap is obviously quite striking in the African countries, which are the ones on the top. More importantly, there is a disconnect between the needs, the skills and competencies needed, the supply, the ones that are coming out of the training institutions, and then the absorption of those people. There need to be jobs for them to move into. It's one thing to train them all, but if there's no job for them to move into because the jobs simply aren't there, then that still doesn't lead to a workforce that is suitably capacitated. One notable thing that came up across the countries was also that there is a lack of structured opportunities to learn from practical experience. A lot of people coming out of the TVETs, the training institutions and universities come with, you know, relatively theoretical skills, also often still a very strong technical focus on sanitation technologies that might not necessarily be the ones that are actually used and implemented in the rural areas in their countries. So there is a bit of a gap between the theoretical knowledge they come out of school with and what actually happens in practice. And so it's really important that there are pathways for them to develop more capacity, more skills and competencies around the actual work on the ground. And that has to come from ways of doing internships or practical experience, building that into the studies, building that into the trainings that they do. There's also a lack of focus on program design overall. So people will still be very much trained on a certain skill, whether it's technical skill or behavior change. What you also need is sort of these generalists that know how to design programs and that know how to undertake oversight, etc. That's a different kind of set of skill set of skills you would need for that. And one point that we found as well was that the way the curricula are built and the people that build them and develop them and then train them aren't necessarily people that themselves have skills in capacity development. Capacity development itself is also a skill. And you need that and knowledge on how you do adult learning and how you do true capacity development. It would help if the sector had more of those people that could make sure that the trainings that are being designed and developed really are effective kinds of trainings and focus on the right things. There's a gap in capacity development opportunities for lower educated staff, low-level skills, if you like, and this is particularly at the local levels. Like I said earlier, if you look at that actual work that goes on at the community level and who undertakes it, most of those are local people, and those people don't necessarily have access or opportunities to go to the secondary level training institutions in the big district towns or even further beyond, but they still need access to training. And this is really a tricky one because this is again where it links back to where there are programs in place, and so where there's opportunities for those people to be trained, but where there are none, those people don't necessarily have any access to particularly any kind of formal or consistent capacity development. And in that, it's also really important that there, in many countries, is really a lack of formal recognition of workers who learn through experience or apprenticeships or just on the job. There isn't necessarily that many places where, as a community volunteer, even if you've been one of the ones that has been recognized and has been used by the program extensively, that's not a guarantee for getting a job. And so there could be more done to build that career path already from that level of volunteers up. And again, and I mentioned this earlier, capacity development is strongly dominated by development partners and by INGOs. And that's in itself not a bad thing at all. It's an important role for us to perform. But where it's important is that there isn't necessarily a continuous effort across time and programs. And also, again, it leaves certain areas and certain parts of countries often with less access to capacity development and training than other parts. But I don't want to end on a low. So there's also a lot of progress has been made, or a lot of activity has been happening in this space of capacity development and training, and that is, you know, the GSTS, the big global sanitation study program that now I think it is 34 universities linked to that across many regions. So at sort of master's level, there is definitely more movement towards training sanitation professionals with that sort of diversity of skills that and that touches on all those different functions that I mentioned earlier. There's also an acknowledgement of the need for interdisciplinary learning, and that's what I mentioned earlier. A lot of these skills around program oversight, program design, monitoring, coordination, enforcement, even they are necessarily, you know, one discipline, and even because a lot of sanitation professionals these days may have a technical background but are actually training on, you know, behavior change. There is a lot of different skills, and so that also means that the way studies are built up, they need to touch on all those different things, and that's tricky. And one point to make here is the cost of delivering that more appropriate or you know, changed sanitation capacity development. You know, universities and TVETs need to invest a lot of money to redesign the way they perform their trainings so that they are more appropriate to what the field needs. And so there has been more investment in this, but there's still more to be done. So that's where I'm leaving it for now. And I'm sorry, I told myself I would try and be slow, but I'm really bad at talking slowly. And this was really, you know, like I said, this is really a very global, touching on many of the different things we have found. The report itself will be in a lot more detail. But just from this, I guess our two questions back to you really is, do these findings resonate? Do you find that this is very much the way what you were expecting? Are there things missing? Anything surprised you? But also, are there other insights or gaps or barriers that you would have expected to see, or that you feel we should be looking into a bit further? So handing it back to Morris to facilitate.
So because we are streaming, really we need to speak into the microphones. So I would ask you, if you do have comments, we just want to take a few minutes to try to break things up a little bit. If you do have comments, please go to the microphone. I think we can pass this one around as well. But please, just any comments maybe before we start passing microphones around? We have. Would you mind stepping up?
Hello. So just really good, Caroline, thank you very much. And one thing I'd love to ask about is the mechanisms for national government to deliver or promote capacity development to local authorities. So local authorities, obviously, that's where sanitation happens at the local level, and they need the capacity now. We, as a result, is a recent thing, I guess, in the last 5 years, with the new with the new sanitation and health guidelines about the about health surveillance and about tracking excreta leaking out into the environment and unsafely managed sanitation. And that sort of skill set of sanitation safety planning is really comes down to local authorities to do regularly. And, you know, so that it's just wondering how those mechanisms, if you found out anything about the mechanisms for national government to ensure that that capacity is delivered, and maybe that's through the sort of capacity development service providers in the if it's outsourced to the private sector to deliver that at a national scale, or if that's done in-house. Things just wanted to.
So I mentioned that there was this big variety of skills that were identified as big missing skills, and one of the big ones there was technical skills related to understanding safe containment and safe management, and then delivering. Well, for one, making sure that toilets that are constructed, you know, deliver those standards that they need to deliver, and then for two, performing any roles linked to safe management later on. This was identified across countries as a huge gap. So I guess the first answer is it's not yet. It's still it's very much lagging. But in terms of the point of the role of central government moving or you know providing, or it comes back down to, and you'll see it in the recommendations just now. For one, it comes back down to local governments being capacitated to hire the staff they need to hire and make the decisions themselves on the types of staffs and the types of skills they most need. And in many countries, they don't yet have that. So there's still a very strong drive from whoever is the sort of the public sector department that places, if you like, you know, numbers of public sector officials in different parts of the country, in districts. And it's more about quotas and numbers than it necessarily is about the skills that those people have. And so this is very much a gap. In terms of the capacity development for those skills, this was one of the things when I was saying earlier, changing curricula, changing trainings is expensive and takes time. And this was very much one of the things that a lot of people were talking about. Like, we need to change the way we're training people, because nobody actually, so far, everybody has been thinking about building a toilet containment, no matter what happens to, you know, the rest. And so there has to be a shift in the training itself. And so I would say there's a lag. That's my first answer. It's not a very satisfactory answer, sorry.
You have other comments, reactions? And if you do, please make your way to the mic and we'll get to you.
Good morning. I'm Rami with USAID Lebanon, and thank you for the presentation. I have two questions. There was a finding about the private sector, the first couple of slides. I don't remember the exact terminology, but it was like the private sector is lacking or doesn't have resources. That was surprising because it's the other way around where I come from. If you could tell us more about why is that? And the second question would be like, was this like a standalone assessment, or is it part of an endeavor to provide recommendations on how to address the gaps or the challenges that were identified by the assessment? Thank you.
Second question first. Yes, the next part will be about the recommendations and the gaps. So, and that will be very much what we want to discuss with you. On the private sector, I think the first point is in sheer numbers, the private sector is still playing quite a limited role in performing rural sanitation and hygiene, and particularly the formal private sector. Where there have been MBS programs in place, where there are MBS programs in place, obviously there's more investment and more training of staff, but overall, that's still relatively limited. The second point was very much about the formal versus informal. And a lot of the private sector roles that are being played are very much done by informal workers, masons that aren't necessarily formalized or organized, and therefore also don't necessarily have access to good training on how to build proper toilets that safely contain. And so that's why we said there's a big gap. There's a lot to be done still to make sure that, for one, the private sector starts investing more heavily in sanitation. And there's a lot to be done around that, which goes way beyond HR. And there'll be an interesting session tomorrow on MBS programming and later in the week as well. On the realm of things that need to be done to make sure there is a more enabling business environment for the private sector to be investing, particularly in rural sanitation and hygiene. And in a way, that has to be a precursor before you can get to the point of, staffing and capacity, etc. And I think this is why I said at the very beginning, this I think is a big difference necessarily between urban and rural as well. We were really looking here at on-site sanitation in more remote areas, and there the private sector engagement is very much informal, very local, and not necessarily well skilled.
Why don't we move on to the recommendation discussion?
Did you?
Oh, I ask a question. You may. I didn't see you. I was trying to be unobtrusive.
Morning. Jan Willem Rosenboom with the Gates Foundation in Seattle. And thanks a lot for doing the study and the presentation. And I had one question that I'm really, really curious about, which is at some point you presented the fact that 86% of countries say there's not enough graduates coming out of training institutions, universities, things like that. And I wonder whether there's any way to say anything about what if we trained a lot more people and these universities started cranking out more people, would there actually be jobs for them? And the reason I ask that is we followed the first cohort of the international group of students coming out of IHE and the Global Sanitation Graduate School. And all of them found jobs, but many were not finding jobs in the sanitation sector. And so my question is like, well, if we want to address that, then what needs to happen? And the second bit is not a question, but more a comment, that if we believe that capacity development is more than training alone, and I think that's what you're saying, then in our presentations, we should be really, really clear to actually make that distinction and not talk about capacity development as if it is a skill in adult education, because that's training again. And that's that question of capacity development often being equated with training, which I think we would all agree it isn't. But then to clearly make that distinction becomes important, I think.
But I think that was, maybe I didn't quite express myself well, because the point I made about the sector doesn't have enough capacity development specialists who could explain, who could make sure that capacity development offerings get structured in such a way that are most appropriate. And therefore it's not just training, it goes much beyond that. That's a skill in itself to understand. And that's why I said it's about adult education, because a lot of this is about how do you train people who are practicing on the ground with all kinds of different levels of experience and skills they may have themselves. Literacy, not to pick up the skills they need. That in itself, knowing how to design those kinds of development offerings, capacity development offerings, is a skill.
I don't disagree.
But
that's training again.
But no, it's not those. It's also, it's about, and we'll get to that in recommendations. It's about peer-to-peer learning. It's about practices that enable people currently in jobs to continue to build their capacities and skills in whatever ways. Yeah. On the first point, so actually Ghana had a very interesting finding there. Don't ask me the numbers now, but there's a specific, the TVET has set up, the Vocational Training Institute has actually set up a course for hygiene promotion and then tracked how many of those people actually found jobs afterwards. And that was a very disappointing experience. You know, the jobs aren't there to, exactly, they're not being absorbed. So there's a big mismatch. For one, there's a lack in capacity development offerings. So not enough people are being trained or capacity or developed in whatever way. But for two, even those that are, might not find a job because there's a complete mismatch. And that's actually a good way into the recommendations. I think, if I may, otherwise I think we run out of time. You think so? Okay. So I'll try and run my way through. We're not so sure, but we'll see how we go with group work or not, depending on the time. We've grouped them, we've grouped the recommendations in three sort of big overarching themes. The first one is creating that enabling environment, which is very much about making sure that the jobs are actually there to be given to people, or for people to perform. The second one is about rural employment and how do you get more jobs into rural areas? How do you get more people into those jobs in rural areas? And then thirdly, a bit around capacity development. So in terms of the enabling environment, I think the first one really is that we need to be undertaking, the sector needs to be undertaking these sector-wide HR assessments and develop costed human resource strategies, more systematically, more often, and especially in countries that haven't been doing that so much yet. But one point to make there is that it doesn't necessarily mean that those have to be very large, long-term, very detailed assessments. Actually, in some cases, it might be better if they're more sort of real-time, quick assessments that give a more direct indication of where big skills gaps seem to be, or in which parts of the country skills seem to be particularly missing. And so one concrete example of this is in Zambia, where there's a skills advisory group in place now whose role very much is to coordinate between them, where there seem to be key gaps and how they might be filled. So they don't necessarily always have to be these sort of, 1 year, 1.5 year, count every number type of assessments, because we know those are very invasive and expensive to undertake as well. Secondly, coordinate across sectors. And this isn't just about better joint planning between programs and tasks, because what it comes down to again is who's in place, who currently plays the role, and what tasks are they intended to perform. And for many people, especially at the local government level, those do go across sectors, and so there needs to be better coordination from the different sectoral ministries and then down to the local government to break down those silos, if you like, and get a better sense of the human resources and how they're being used or needed by the different fields. And, this is across sanitation, hygiene, solid waste, agriculture, education, health. A lot of the actual rural extension workers at the local level are expected to perform roles across all these sectors. And so there needs to be better coordination and planning between those. And then this is one of the crucial points, and it really comes back to what Jan Willem was just saying: develop and professionalize a sanitation and hygiene labor market. Now, this is obviously the big one and also the most challenging one. And the very first bullet, I think, is really obvious, but we wanted to put it there because it's like a key obstacle to this. Developing a labor market costs money. You need to have the funds to be able to pay those people their salaries. Never mind everything else that comes with setting up the labor market. And one other important point here is really about working towards standardization of jobs and roles and needed qualifications. And this would also help counteract some of this issue with the projectized way our sector is working. Because if at least all those programs and partners would be using the same roles with the same functions, more or less, that would make it much easier for people to move across programs and move on after programs close into other roles with a similar description. And particularly for government sanitation and hygiene roles, there are if you look at health, there's a very clear career path people can follow in the health sector. There isn't that for sanitation and hygiene. There isn't, you know, I'm starting as a community sanitation mobilizer, and then my next job will be a local government, you know, sanitation specialist, and then my job will be, there isn't really that path at all. So that if there's more standardization of roles and functions and jobs, that would be easier for people to grow into. But that obviously that requires, you know, coordination that goes much beyond the WASH sector. This is about the Ministry of Education, Economy, Labor, those different, you know, ministries that help shape labor markets, really. And a really important point here is about empowering local governments to make their own decisions and have the resources that they require, but also the policies, the regulation, the processes in place that enable them to make decisions on what staffing they need with what kinds of skills. Because so far there is still a very strong centralization in many countries of particularly public sector staffing processes. And obviously the more local governments themselves are in charge of who they need to hire, the more flexible they are in making sure that they have the right human resources with the right skills in place. Then we move on to this issue of rural areas and incentivizing, encouraging employment in rural areas. Because obviously this was a key finding also in one of the glass finding slides. I didn't talk about it, but you know, people don't necessarily want to work in the most remote areas, especially not people that have been trained at a certain level. And you know, for a variety of reasons, they want to be close to where there are, you know, more opportunities for education for their families and the children, etc. There are many, many reasons. So encouraging and incentivizing employment in rural areas is really a key part of what we've been trying to look at. And so some different things to do there. Firstly, is about incentivizing. And again, that comes down ultimately to making sure that there are financial incentives for the rural workforce, whether that's additional pay or health insurance packages or, you know, family support benefits, whatever they may be. But again, those cost money. So this is one of those long-term transformative recommendations, not necessarily one we can put in place right now. Secondly, and more intermediary, something that can be done more effectively is around coordinating across local public sectors to attract and retain that rural workforce. And again, I made that point earlier about at the local level, many people perform many different roles across sectors. So they may be working on solid waste and on transport, agriculture, or health and hygiene and sanitation. And so again, if there's more coordination at that local level, there might also be better ways to make sure that people can be retained in jobs. Even if they switch roles, they may be at least retained in the public service at the local level. And then there's just many different ways of creating incentives programs, reward programs for good performance, back to also rewarding, you know, local governments that are doing particularly well, etc. And I think an important part of this is as well, and I didn't speak about this at all in the findings because we had to select a bit, but there is still stigma on being a sanitary worker in many countries. And so the more that can be done to break down those stigmas, the more it might also become a career choice people might want to make, which they currently don't necessarily. Promote, and I don't mean promote as in, marketing. I mean promoting up, making sure that there are paths for people to follow upwards. So that comes back down to capacity development programs and schemes that can enable volunteers to transition into formal local government roles, but also recognizing experience as education, point I made earlier. And that's a point especially for women, because a lot of this, it's clear in some countries than in others, but there are countries where if you look at the environmental health force, that is a role very often performed by women. And those are often women that don't have formal education or very little formal education. But if that role that they are playing could be formally acknowledged as experience, and that experience would count, or would count to something, that could at least be a way to get into professional or official jobs at least. Enforcement, public sector rotation, and those things are some countries do this. Every 5 years you need to move to another region, another area if you want to stay in the public employ. There are things that can be done like that. but also really introducing internship or trainee programs in rural areas to familiarize the upcoming professionals with working in rural areas. And so this was very much about what I said earlier about building this into the way trainings are established, that there has to be a practical part to, if you're doing a 4-year formal training, whatever, 6 months of that should be actually working in the field at the rural level. Diversify, diversify local government teams. And this is really about those functions I started with. And this differs a bit per country. In Nigeria, it was very clear that if you looked at the WASH units, so the local government staff in WASH units, they actually are quite diversified in the roles they play and the skills they have. But many countries like Ghana, it was very clear that the environmental health officers was the biggest part of the workforce. And so there weren't necessarily many technicians or people with, monitoring background or oversight, etc. So that diversification of the roles you need and functions you need is very important as well. Formalize the informal. So this was a bit points back to the question you had earlier. The informal sector can be a force, is a force already in reality in many countries. They are the ones emptying pits that need to be emptied, etc. Whether they do it well and what happens to the sludge is, might be different, but they are playing those roles already. So is there more that can be done to bring them into programs or into, coordinated ways of delivering services in local areas? But also developing certification schemes for example, for masons and artisans, so that they also get trained on building better, more solid facilities than they might be doing at the moment, taking into account that stronger focus on safe management. And I think very importantly here, I do think there's a gap, and it'll be interesting to hear from people that are working with private sector. I don't think we necessarily know enough yet about some of the best channels but also the implications and the unintended consequences of formalizing the informal. And so I do think that would be an area where we need to learn more before we make these big recommendations and then actually land people worse off than they were before. I mean, we know about roles that were typically performed by women. As soon as they become formal, they might become more interesting for males. And there are these kinds of consequences that we really need to understand. And then this point of brain drain that I made earlier, this is really an area where we'd be really interested to pick your brains, because some of these recommendations we are aware are still quite high level and not necessarily very, specific doable actions yet. And this is one of those. We know that there needs to be ways in which the public sector can work together with the private and development partners to make sure that people have an opportunity to be retained in the public system, even if, and it might be things like, placements or rotations or secondments when there are programs in place that they might be working for a while for the UNICEF funded program, but they go back into the local government afterwards so that those skills and competencies that they have picked up get retained. There need to be ways in which we can work together better to make sure that that brain drain away from the public sector gets slowed down at least. And another really obvious one, but one that clearly I don't think we've all been doing quite systematically enough, is about assessing the existing staff workloads of the people that your program is planning to work with before you roll out your program and before you overload them with more things you want from them. And that really should be something that should be like a principle for NGOs, for development partners to start with. So then lastly, a few things on capacity development. Coordinate capacity development better. Ensure that national government-led coordination mechanisms or processes are in place so that the providers and the sector actors really deliver, talk better among themselves to make sure that the gaps that are currently recognized, whether that's in terms of certain skills or competencies not being trained or whether that's about certain regions of the countries being less exposed to training and capacity development opportunities, etc., to address those kinds of issues and develop a stronger workforce overall. one thing that can be done there is developing a development partner or INGO platform to coordinate and plan capacity development efforts. And that really includes then also the efforts across geographies. And the point I made earlier about that we saw a very clear alignment between where there is a lot of program activity and where government staff is better skilled and capacitated. And so there needs to be more that the partners can do to better coordinate across, so that that offering gets more equally spread across countries and across people. So yeah, strengthen the TVETs and the university courses, but also really, I think one important point here is about localized capacity development and support mechanisms. And that's back to those lower level skilled people or the volunteers that are very much working at the local level and don't necessarily have access to mechanisms for them to build up their skills and competencies over time. And so that is much less about formal training and much more about mechanisms that enable them to either exchange, etc. And so the next slide is very much about, ensuring mechanisms for continuous and on-the-job learning. And obviously, we know that peer-to-peer learning has some precedents, and we think there's more that can be done there. And that's also something being looked at by others in the sector. But there are other vehicles as well for learning. We knew about a scheme, and I've lost the country now, but where there are actually phone trainings happening between local government staff, where every Monday or every whatever time they have a session, they talk about a new theme, and it's very much about exchanging between the people in those roles about what their challenges are, what they can learn, etc. So there are mechanisms that can be put in place and things we can do collectively to bring learning more easily towards people at the local level performing these roles. So that was it. And so since we've taken a bit longer so far, then we have got about 20 minutes left. So I think maybe rather than going into group work, it might make more sense to just get your initial feedback. One point I will make, and I didn't make it when I started talking about the recommendations, these were all, the way I presented them to you now, are quite high level. They don't yet say, a development partner should be doing, the government should be doing. That is obviously where we want to get to next. And we had initially started to do that, but then they didn't fit on the slide. And so, but that is, really the how, the practical implementability. All right. Of some of these recommendations is really what we'd like to hear from you on, as well as if you feel there are some very glaring ones that are missing from this. Handing it back to you.
And what I would add, as Caroline mentioned, that this is a study that's underway. I think that the findings and recommendations are still taking shape. They're still morphing into something that's a bit more concrete that will end up in a roadmap type of document. And the purpose of that, and the purpose of these kinds of consultations also, is to begin to identify partners and organizations that are interested in carrying some of this forward. It may be programs that you're already a part of or that you're thinking about, but the roadmaps will be developed at a global, more general level. There will be specific recommendations for the 6 countries in which we are working. But part of this also is to engage, make you aware of what we're doing. And if there is an interest in moving forward with the putting in place some of these recommendations, then we look forward to hearing from you. Is that so? As Caroline said, in lieu of the work groups, and to try to get some feedback, we can also not necessarily have to go to the microphone at this point. The work groups weren't going to be streamed, so I would hope at this point that maybe we can just begin a bit of a dialogue on your reactions, reflections on the recommendations, and any additional questions that you may have coming back to the findings, if you would. So from where you are, raise your hands, please comment, ask. Yeah, Pete.
2 points, which I think is just reinforcing some of what's already been said, but we have presentations that quite rightly are multi-level. That there are needs and capacity improvement at all levels. And I just worry about the way things are funded. The mechanics of it is that in many places, local government doesn't know what its budget is almost ever, really, but they find out at the last minute. And different ministries don't know. And so a lot of the coordination or a lot of the planning, even what's desirable with their team. Correctly, there's a long-term career, which doesn't necessarily mean a job in the same place, but having a job in the same place is sure nice. It's a good way to build a career. And those options. I just wonder if there's any comments about that. I mean, as I say, you haven't hidden that problem, but it does worry me, the question about funding at different levels and how uncertain funding is. And the second one that just popped into my head, and you can probably comment on it, is, are there any possibilities, and have you already gone down this track, about learning from other sectors? From agriculture is the one that springs to mind, simply because they've had extension services and they've been able to do, I think, some of these peer-to-peer learnings from across different regions. Because I would hate to pass up an opportunity, and obviously that again is a local issue. I mean, if you find one sector has learned how to do this kind of thing well, then you glom onto that one, and it will be different ones in different areas. But construction seems to flow pretty easily because there's a market for it. Yeah, I don't know. But anyway, I just wanted to pass it on.
No, I very much agree with the point about certainty of funding. And to be very fair, when we started this exercise in the early discussions with USAID, we're like, a lot of the problems we're going to find and the solutions we might point towards are solutions that are somewhat out of the hands of the sanitation sector, right? But yeah, so yeah, very aware of that, but we can still make them and continue to talk to those players outside of the sanitation sector that need to make. But that's also why there was a point about, make sure that local governments are mandated and resourced. They are mandated and resourced, right? If they don't have the financial resources to make those decisions and ensure long-term funding, not just the salaries, but also exactly any kind of capacity development trajectories. Yeah.
Yeah, thanks. John Scott, maybe building on the point that Pete said, and also what Andy and Erica said earlier, I think this issue of institutionalization and who does and who pays for this, right? I think that there's what we're sort of finding and trying to embed some of the business development skills is that there's like unsung ministries, right, that actually end up being our real partners, like in Ethiopia, the Ministry of Labor and Skills, where we never thought of that in the very beginning. I think in the Liberia work, though it's early days, we're looking really as our main partner as the Ministry of Internal Affairs. And they're the ones we're going to expect to kind of drive and sustain a lot of this work. And then, I mean, the most successful, I think, example of sort of building local capacity within government to maintain this is, of course, the watershed model, right? And the civic champions. So I'm just thinking, like, how do we start to think about, like, who does, who pays, and who really those unsung partners and heroes are? Thanks.
Julie. I'll just add, I think that's a hugely important point. There are a lot of the programs we tend to go to our usual cast of characters, and we don't, I think, do that initial assessment early on, or even find the mechanisms or understanding what the roles and functions and potential functions of some of these other groups could be. I think we're too perhaps focused on the usual cast of characters. And I think that's a great point, John. Yeah.
Hi, all. Julia Rosenbaum with FHI 360, part of PALS 2, but not this assessment by disclaimer. The findings really do resonate, I think, for me and a number of us, which is a really vital ground truthing to things like this. I was particularly noting some of the comments around how donors, and by extension, implementing partners, skew the sector, and in some ways perhaps better, and also things to be mindful of and take note. I mean, perhaps not across the board, but often USAID, for instance, won't fund routine personnel positions. So is it a question, and you're not yet at the stage of interpreting this, but is it good budgeting, if you will, that that at both federal and local levels, if you can't get your staff, you shift around your funding and that's a good thing. Or are we actually draining from other regions that aren't getting the funding? Are we making it worse off? So what's the impact of all that shifting, I think is an important inquiry that this study may not get to, but that some of the sort of implication. As to Pete's comment of learning for other sectors, I was also really struck about the notes of professionalizing what's now often volunteer, and how that's a vital role. I think a gender lens is really critical to put on that. I was quite involved in HIV work in sort of the earlier stages. And as the volunteer cadres got professionalized, men bumped women out of all that work. As soon as it became a paid job, it completely skewed the sector. So all very interesting. Those aren't so much questions as comments, but thanks. It was really a provocative session for me.
I think there was a comment way in the back, and then we'll come over here.
Yeah, so I was a bit curious about finding the average ages of WASH professionals in, for example, Southeast Asia, vis-a-vis Sub-Saharan Africa. I was thinking of this because I find, for example, in Nigeria, which is a very populous country in Sub-Saharan Africa, 36 states, I mean, almost 250 million people, there are a lot of WASH investments. But you go to most of the water corporations and the average age of all the general managers are like 50 plus, getting ready to get retired. And you don't have young people who are stepping in, and you see infrastructure so much depleted that the young people don't find it exciting, especially to work in the state government level. Yeah, so I was wondering whether the research actually looked at some of these capacity needs and how to encourage young people to go into this area. Thank you very much.
Thank you.
Well, I'm Henry from USA.
Yeah,
Just-
very good point. And somewhere in there, there was a point about, particularly again, that point that was made about local level opportunities to build capacity and bring people into roles. A lot of that has to be obviously about making it effective, bringing young people, being able to bring them in as volunteers, but making sure that they have capacity development, they can go into roles.
Hi, my name is Ruthie and I'm with Sanergy and Fresh Life. So I will admittedly bring some urban thinking, and you can all call me out on why that's not applicable, and a little bit of a private sector lens as well. I think one thing that stands out to me, something I'm really proud of about what our team has been able to do, is because we're a company that's existed for a decade, there's a tremendous amount of capacity development and promotion and room for kind of building a culture. And I think some of what I hear with shifting timelines and kind of fixed program lengths with funding, just want to kind of point to the potential of investing in small local enterprises. We are not the best example of a small one, but small local enterprises where that culture can be built over time, where some of the capacity development, it doesn't quite happen naturally, but it can be more ingrained in the culture, and it can be something that a young team member comes in and 2 or 3 or 5 years later, they find themselves in a position where they can kind of pay that forward in a way that makes more sense and doesn't quite have to be so institutionalized. So with hopefully sufficient recognition of all of the ways that my perspective is not directly applicable, just bringing that in, and would love to kind of hear if there are any ways that that is consistent with your findings, or ways that you could see that being integrated.
All right, why don't we take one here and then the last one in the back? And then we'll begin to close up.
Good morning.
Alberto.
I am Alberto Wild from Global Communities, based in Ghana. I want to touch, I want to build on the point that you mentioned about the the dependency on volunteers and also as well the fatigue on the environmental health officers, which it happens often, especially in the programs that we are implementing in Ghana. One of the recommendations was the rotation of staff as way of motivating people, but we find this as one to be one of the problems. As much as we try to build the capacity, when the capacity is built, the people rotate and then they disappear or they get transferred elsewhere. So my point here is I would like to be part of this, and any recommendations that you might have or suggestions for that, I'll be happy to implement those in Ghana. Thank you.
Thank you. In the very corner. Yeah.
Thank you so much. Patricia Namakula, USAID Uganda Sanitation for Health Activity. The findings resonate a lot with our experiences working with health assistants and environmental health department staff who do sanitation and hygiene work at the community. But I want to draw attention to two things that kept ringing a bell in my mind. The first one is we have the schools of public health where these cadres are trained. Now, these schools design the curriculum under the Ministry of Education. So the Ministry of Education does the curriculum and these people are trained. But it's amazing to note that this curriculum was done many years ago. Sanitation and hygiene trends have shifted. Where is the integration of the Ministry of Health with the Ministry of Water, the Ministry of Health in this? So they should be thought about and see how do we bring in the SDG concepts. People get out of this school and they've never had something like safely managed. They're like, what's that? Or basic sanitation. So they leave and they're in the field, but they're struggling to understand concepts. So how can we make this more practical at the lower level? The other thing would be, how do we ensure that these people are more motivated at work through things like results-based tracking? It goes back to the issue of the challenge, especially in monitoring and evaluation skills. Because if people just go to the field, spend a day, visit a couple of households, where are their efforts recognized? Who is supervising this person? How do you reward them? How are they using digitized data to inform their implementation? Is their implementation just about monitoring day in, day out, or are they aimed at ensuring that they're able to track improvements in these households they support? So those two things, I think, could contribute to the next steps you mentioned. Thanks.
Thank you very much. Did you want to? Yeah, Joanne, maybe we come back where we started, then a few last words from Joanne, and then I'll we'll begin to wrap up.
Thank you for ending the presentation with a positive note with your recommendations. You probably brushed this on your recommendations on the enabling environment, but I just wonder whether your research also looked into to what extent the national targets are linked to the local targets. Because I'm saying this because what I've seen in the Philippines is that so the national government has articulated their goal to universal coverage, right, as a commitment to SDG 6, but there doesn't seem to be a mechanism to link that national target to the local government. And so I was wondering if there's a way to localize those national targets, then the local governments would be driven or motivated to increase or expand services at the local level, and would that expansion actually influence the supply of workforce in the sanitation sector? Thank you.
Thank you. Yeah, just a quick response.
Very concrete example that is in the fall where local governments that have done their local wash plan can get budget. So it's, budget is conditional upon having done it. So there are.
Okay, so thank you very much for your participation. Sorry we didn't get a chance to mess up the room and get into work groups. I did want to give a last word to Jan Willem, but we very much appreciate your support here.
Thanks, Morris. And now everybody is wondering, it's like, why the hell does this guy get the microphone for a last word? And that's primarily to say a big thank you to you for doing this work and presenting the data. I think we can very much say capacity development is one of the 5 accelerators in the SDG acceleration framework, but it's very much a forgotten accelerator. We don't have a lot of data, not enough people are engaged in it. And if you talk about the accelerators everybody is familiar with, it would be, you know, let's talk about money, finance, let's talk about policy development. So great. The reason I'm now talking about this is that I want to invite you all tomorrow to continue this conversation in the plenary between 10:30 and 12, where we have a plenary session in Grumman Hall, where with people from the public sector, the private sector, the usual targets of capacity development, as well as some of the providers of capacity development from ITN in Bangladesh University and funder of capacity development, to kind of reflect on some of the issues and particularly how those of us that are in a situation to support capacity development, finance it or perform it, can better listen to the people that say we need more capacity or capacity development. So if you want to continue that conversation, be part of it, please join us tomorrow for the plenary. Thank you very much.
And just as a very, very last word, I do want to acknowledge the work of Kirsten DeVette, who is the lead consultant for this work, and then our in-country consultants in the 6 countries in which we worked. And they're the ones that have been out there collecting this data, having the interviews, and feeding it back to us. So this process will continue. And I do appreciate Alberto and any others that are willing, you know, to continue to work with us on this, to please let us know. Happy. And again, thanks very much for attending our session and enjoy your week.
If you happen to have one of the sign-in sheets, if you could please just bring it up and sit on the front table, I would appreciate it. Thank you.
You can see my my old.
That's right. Yeah, but still, I thought it was a different thing.
Well, what is nice is that it seems to, I didn't see anybody frown on any of it, so I didn't see anybody frown particularly on any of it.
That was really good.
Thanks.
Good to see you.
How are you doing, Henry? You well? Oh, yeah, thanks for coming. Yeah, it was too much. Well, we were hoping for the end of the year. Yeah, no, to be honest, yes, that we will. And we will be continuing conversations as well on, particularly on the roadmap fund. So yeah, that's why partly like you take all your data. Thanks.
I have part of it, but it's not negative, but. Oh. Now, relearning what I learned in America. No one here is going to use it. Where's more? It's like nationally. The home is really built. I know. But I think you serious. You do.
We're my friends here.
Yeah, fair. What is it? So I should add the talking here. Exactly.